that is a no-no. You cannot do scalp micropigmentation. I wouldn't suggest you do scalp micropigmentation. The question was, someone asked me, how do I know I'm not going to react to if I get a scalp micropigmentation, or some people call it hair tattooing or hair shading, whichever one. Look at the picture above right here. So we have to do something called a patch test. Just the way before you use any product, they want to test it on a part of your skin. So the same thing, they test it on a part of your scalp, just a little part of your scalp, and let it sit for some time, like 30 minutes, to see if you're going to react to that. Now, the question should be, some people can have an immediate response or delayed response. So how do you know? If they don't have any response immediately, 30 minutes, 45 minutes, you can ask them, always instruct them. Always instruct your clients. If they're having any shortness of breath, they feel like their throat is closing up, they're having pain, throat pain, they are nauseous. Those signs and symptoms, they need to call 911 or head over to the ER. They have to. No questions asked. You have to make sure you let your clients know. Now, we have to understand something. Now, I'm going to classify into two reactions. Are they having side effects from the ink, or are they having an allergic reaction? So the person doing your scalp micropigmentation should be able, to know the difference between those two. Yes. What are the symptoms, or what are the signs that someone is having an allergic reaction? Okay. You might expect you see some itching. Okay. You can have some swelling of that site where the ink was deposited. So if you see all that, now the second question is going to be, do I proceed with the scalp micropigmentation if I have those reactions? Now, if you have a severe reaction, like I mentioned earlier, the swelling, the throat swelling, you can't swallow, shortness of breath, that is a no-no. You cannot do scalp micropigmentation. I wouldn't suggest you do scalp micropigmentation unless you're getting the scalp micropigmentation at the physician office. They know what to do. Yes, I wouldn't suggest that. Why do I say at a physician's office? Because sometimes you might have to pre-medicate the patient with some steroids, or steroids, Benadryl, but that person has to have a designated driver. Okay, so that is it.